Is that better? So I'm Melissa. I identify as a CRA, Certified Radiology Administrator. My current role is Assistant Director of Outpatient Imaging at Shannon Health in San Angelo. It's about 3.5 hours west of here. I've been a technologist since 1993, and I've been in leadership roles for over 20 years. I've been fortunate enough to work at many different facilities, just down the road in Austin for about 15 years. I'm an active member of AHRA. I was in Leaders of Choice last year, and I'll be speaking a lot about that today. So today's objective is, this is ringing really loudly. I'm too close to the speaker. Okay. I may not even need it. I talk loud enough, but you guys let me know if it's annoying. So today's objective, I'm just going to talk about the mindset principles of a leader, learn how having a positive mindset can really affect and shape the culture in your department, and just to build your leadership legacy. So I'm just going to start out with some of the basics. Definition of mindset. The Webster Dictionary is mental attitude, and I'll talk a lot about attitude. And then vocabulary.com, habitual or characteristic mental attitude that determines how you will interpret and respond to situations. So I don't know if you've ever seen this diagram, but there's growth mindset and there's fixed mindset. I really used to think that I had a fixed mindset. So growth mindset is just knowing that I can learn, I can do, I want to. Failure is an opportunity to grow. Feedback is constructive. I like to try new things. Being open to change. Fixed mindset is you believe you just kind of, that's the way you're born. You can't change, you can't learn, you can't grow. So like I said, I really used to think that I was terrible with math. I still am. I just don't like it. It's kind of what, when I drill down into it, I can do spreadsheets. I'm not good at them, but I can learn it and do it. So I think that we can be a combination of both at times. But as a leader, we want to have that growth mindset. We need to have that healthy attitude towards change and being willing to develop that. So why does any of that matter? If we are negative, if our thoughts are negative, that's going to affect our day. It's going to affect how we respond to people. If we're in that positive mental attitude, then your day is better. Things will go better. You'll be able to make better decisions throughout the day. And then we all know that negativity spreads so fast. Well, positivity does too. So I went through a tough period a while back. I lived in Seattle. I ended up being alone in Seattle. It is not the friendliest place on earth. There's a thing called the Seattle freeze, and that's real. People freeze you out. If you're from there and you have a family and friends, then it's okay. But if you're an outsider coming in, especially someone from Texas, they aren't friendly. They aren't welcoming at all. So I ended up being by myself. I didn't have family there. And so I struggled to get up and go to work. So I had to change my mental attitude. I had to change the way I thought about being there. And so I would get up and take my time getting to work, and I would walk to work and I would look around and I'd say, look how beautiful. Like, I've got a Lake Washington right here. I can smell the fresh air. I can hear the seagulls. So I just started changing my mindset about it's okay that I'm going through this situation. I'm looking around, and I started embracing it instead of focusing on the negative that I'm here by myself. So I started just doing some positive affirmations, and I would tell myself just something simple in the morning when I was waking up to get out of bed. I would say to myself, I am brave, I am strong, I can do this. And my husband laughs at me because he's retired now. He was a coach and a chemistry teacher for 26 years. And he doesn't have to get up early now. He does his own business. And so he's laying in bed, and especially in the wintertime, it's very hard because it's cold and I have to get up and go to work, and I tell myself out loud, I am brave, I am strong, and he kind of chuckles every morning. But it's so helpful just to have that positive mindset, something simple to start your day with. So some key behaviors that we see in leaders that have positive mindsets, and things that you can hopefully take back and work on as well. And I think that we could spend a whole hour talking on this first point, being a leader versus manager. I think it's so important because I took a transitional job to leave Seattle and come to San Angelo. It was kind of right after COVID hit, a little bit on the downside of COVID. It was in 21, but I knew I needed to come back to Texas. My sister had a mild, it was a TIA, let's face it. She didn't have a stroke, but she thinks she had a stroke. So she had a mild stroke. And my dad's in his 80s up here in the hill country. And so I thought, I better get home, it's time. So I started looking for employment. And at the time, I was talking to my now husband. We were childhood friends. I've known him since 6th grade, and I have a corny story. Facebook brought us back together. And so we are now married for 5 years. But when I started looking for places to come back to work, I knew I really didn't want to come back to Austin. I'd been there for 15 years and felt like I had gone as far as I could in that organization. So I was just sort of looking around. And he said, well, why don't you just come to San Angelo? We don't have to live together. You can get your own place. And he was like, but my buddy knows of this manager job. And so I took a look at it, and it was a manager job for a plasma center. I don't know anything about plasma. I didn't even know where do you actually get plasma and what do you do with it? But I thought, I'm a manager, right? I can manage anything. So if you are a good manager, that's true. You can step in and learn how to manage a facility or department, and it's task oriented, right? It's payroll, it's work schedules, it's ordering supplies. So you can manage really anything if you have those skills. But to be a true leader, I think that's something different. Don't you agree? So I've really shifted when I talk about like radiology managers or management. We've all started the shift to say radiology leadership, right? Because we want people to know the difference, that yes, we are task driven, but we're your leaders. We're leading you hopefully to something better. So just modeling optimism, just looking for the positive. And I'll be honest with you, I have not always been that positive person. When I was once told that, man, you're kind of really like negative, or you have like a negative outlook, I said, do I? Because I really thought I was just realistic. So is that really negative? Maybe it is. So I do have to work on finding the positive thing first. And I really started doing something where always kind of looking for the silver lining in things, and that's kind of helped me be more optimistic. So I'll talk about silver lining things in just a little bit. But another behavior is being encouraging and inspiring. I never really thought that I could be inspiring to anyone else. And then recently I did a podcast for AHRA with Jason Nort, and we talked about my leadership development class that I talked about yesterday, but that was so much fun. And when you're doing it though, you're doing it, just over the computer. It's just a conversation. And so you don't see your audience like I see you now. And so you don't really know who all you're reaching. You don't know who's going to listen to that. You don't really see it. So I didn't think too much about it. I was excited when it was broadcasted, but I didn't, again, think anything else about it. But when we were in Vegas this summer at AHRA, I was walking down just the hallway, maybe to another class, and a guy looked down and he looked at my name tag and he goes, "Oh, you're Melissa Ramos?" And I said, "Yeah, why?" He was like, "I heard your podcast." And he said, "You said something that's resonated with me." And I said, "Really? I did? What did I say?" He said that you said something about always being the one in the back when you're in your organization saying, pick me, like pick me for that task, or hey, I'm here, I want to do that, like pick me. He said, "I feel the same way." And he said that inspired him to keep going because of the things that I had done. And so I thought, oh, maybe I am inspiring. I don't know. But as leaders, that's what we want to do, inspire our teams. And then with our teams, I think it's important to acknowledge challenges that they face as you're going through changes and progression. I think sometimes we overlook doing that because it feels more negative, but I think it's important to say, I recognize that we are going through these changes or challenges, and I'm here to support you. And celebrating the wins, I think any good leader does that. I've heard that throughout several talks this weekend. Is positive reinforcement, recognizing and rewarding employees. Mario talked about how he sends thank you notes to family members of staff, and I thought, wow, that's pretty amazing. We do some handwritten notes too to team members. They tend to like that, but I've never thought about doing it to their family and friends. That was really cool. That to me takes it to the next level. And so that's key behaviors of leaders with positive mindset. And this last bullet point is one of my favorites, and I talk about it a lot because I do believe in it, but truly care about the people you lead. Get to know them, get to know what they're doing, get to know what they're going through, and it'll make a huge difference and impact on your department. Again, this one means a lot to me as well. Sorry, I had to take allergy medicine. I'm all dried out. So how are you greeted and how are you treated? I think we all know that if our employees are happy, our patients will be happy. We've all said that, I'm sure, at one time or another. But it makes such a huge difference. And I think what we often don't think about is I've called people on the phone because, maybe I've got a question or I need an answer to something right away. And they pick up the phone, "Hello, what are you doing?" Or "How can I help you?" I'm like, "Gosh, are you having a bad day? Like, what's going on?" "Yeah, I'm just really stressed, a lot going on." And it made me feel bad. I didn't want to, next time I had a problem, I didn't want to call that person. So I think that's something to remember too. When people call, they're usually, as leaders, they're needing us. They need something from us. They need guidance or direction. So I always make sure that I answer that phone cheerful. "Hey, this is Melissa." Now we all have the caller ID. You can see who's calling us. So they know they're calling me. It says so, and I know who they are, but I still say, "Hi, this is Melissa. What can I do for you?" Or "How are you?" Greet them. I think it's so important. No matter what I'm doing, I'm busy, I'm stressed out, whatever, greet them. I used to I had a team of schedulers. I bought them little mirrors one time, and I had them put the mirrors in front of their computer and their phone. So when they picked up the phone and answered, they were looking at themselves in the mirror, and I made them smile. I said, people can hear your smile through the phone. It's so important. So again, just how are you greeted and how are you treated? If you're trying to shift the culture in your department, this is going to be a huge thing. One time I had a supervisor in the breast imaging department, and she was an introvert, but she was that manager. She was that task-oriented person, and she was great at it. She was very smart with IT. We were switching over from film screen to digital, and she was all about it and all in it. But every morning when I clocked in and walked by her, passing in the hallway, she would do this. It made me feel terrible. And I would say good morning, and she wouldn't say anything back. So again, as leaders, we're expected to kind of always be on, always have that smile, always be shining no matter what. And that pushes your people to start their day. At the end of the day, when they were clocking out, they would walk by my office and I would say, hey, thanks for being here. Have a good night, no matter what. 20 people walking by. I made sure and said that to everybody. So research shows leaders can create a positive emotion with the people around them. So we love research, don't we? But I think again, it's such an important concept. It's something so small, but it's something so important, and it will build that trust, and it helps you keep that mental attitude. So how do you do it? How do you develop this? You put people first. And that's, again, I've had leaders, I feel like I've kind of patterned my leadership style over the last years based off of leaders that I didn't think were so good. But I learned a lot from them. We had a leader early on when I was an x-ray tech, and we would always get slammed with x-rays between 11 and 1. Why? Because they're all getting out of the doctor's office. So they're coming to the outpatient clinic to get that x-ray. In West Texas, it was Midland. We did tons of chest and sinuses. Why did you need a sinus x-ray? Just give them the medicine, right? But everybody had chest and sinuses. And so we would have just tons of x-rays. We only had 2 x-ray rooms at the time. And our break room was right across from it. And so there would be, we're taking shifts for lunch. So there would be one of us trying to knock all of those patients out at a time, maybe 10 at one time. And where was our supervisor? She was sitting in the break room with the door open, eating her lunch and laughing and talking with others in there. That was the most stressful thing to me ever. And I remember it all that time ago. I'm 54 now. I was 21 then. It had a huge impact on me to watch her doing that while we were out there struggling. I'm not saying as a leader, don't go to lunch, but make sure your teams feel supported and have the resources and things that they need. And then that builds trust. Talking to your teams, making yourself available builds trust. Listen with empathy. And that's a tough one for me too. And I never really understood empathy. Brene Brown has a great video on empathy. If you have a chance, Google it and watch it. I accuse my husband all the time of not having empathy. I think that if he hasn't gone through it, he doesn't understand it. So I would have to say that I was like that a little bit too. But you can learn empathy. I really believe you can. It's not the same thing as sympathy and feeling for someone, but what I have found, what people are looking for when something bad happens to them, I have an open door policy. My door is always open, and people tend to come in and sit down and talk. And they'll kind of unload their problems or whatever happened. And I used to want to counter their story with my story or a story because I thought that made them feel better. And then someone told me what I was doing was making that about myself, not them. And I wasn't truly listening. And so once I kind of sat on that and thought that through for a minute, I was like, yeah, you're right. I see your point of view. I was just trying to make them feel better because I could relate to them what they were saying, but that isn't what they wanted. They just wanted that empathy. And in that Brene Brown video, she kind of helps explain that out. But what people are looking for is for you to say, I'm sorry that you went through that, or I'm sorry you're going through this situation. Is there anything you need from me? And so it's just those simple responses, and all of those things will help build trust with your team member. Again, recognize and reward and communicate clearly. Uh, and then you just have to practice. Like I said, I haven't always been able to be empathetic. I've had to learn it and I've had to practice it. So I think that when you make connections with people and put people first, then those things will really go a long way to having that positive culture in your department. I don't know if you guys have had a chance to hear Jake Moore. He's doing some webinars, I guess, on the AHRA forum, and I actually got to hear him in Florida speak. And he is an amazing speaker, but he talks about that human business, human connection. And I really feel like that's something so important. And I've started practicing that in my own department. And you can practice it with something simple as emails too. So you make that first connection with human by greeting, and then you can get down to business, and then you close it up with human connection again. So in my email, if I'm responding to something big, maybe I'll just type out the answer real quick, and then I go back and clean it up and put all the niceties in, like hello or good morning, and then I wrap it up. Thank you so much. Let me know if you need more answers or whatever it is. So just making those simple changes and making those connections with people really go a long way to that positive culture. So by doing all those things, this is the impact that you're going to have. You may not be able to obviously change the entire organization, but it has to start somewhere, I believe. And if you started just practicing these things in your department, you'll see the culture change. We are in that survey window. We do a culture survey every year. We are rolling it out. So this is a chance to see how we're doing. We've made some changes in the organization and in the department. So I'm excited to see if there's been a shift. But we get these culture surveys, and as leaders, we kind of cringe, right? Because we are trying so hard, and then you get these feedback, and it may not be what we're looking for or what we want. But if we've got that positive growth mindset, we're going to take it as a positive. So I'm just really looking forward to seeing what they're going to say this time around for us. But the culture surveys are tough because we sit in the room with our VP and we go over the results, and they say, well, what are you going to do to fix it? You know, it's up to you. This is what they're saying. You need to fix it. So no one's giving us the solutions, though. They're just saying you need to fix your culture. I think these things are what's going to fix the culture, is having that positive mindset, leading with purpose, and having an intent. So if we can make some shift in our culture and make it more positive, we know that's going to lead to employee satisfaction and ultimately retention. So again, how to do that, how to change culture through your mindset, is set clear expectations for your department, for yourself. Demand respect. If you have somebody being negative and you walk through that, I often do that. I walk through an area and I walk through the tech area and I hear them, somebody negative. If I have time in a nice way, I may say, hey, let's talk about something else, or hey, why don't you come see me and let's talk about that in my office, because nothing spreads faster than that negativity. So it's on us as leaders to squash that and do it in a respectful manner, but you've got to do it also timely. But the changing that culture, it starts with us. So I can't just walk away and let that happen. I've got to somehow attack that. So again, just setting those clear expectations for what you want to see in your people. And then provide that coaching. provide that mentorship. We've talked about, several of us have talked about that throughout the weekend about mentorship. And then just being, able to coach up our teams and putting yourself out. And then just being present with your team. I can't stress that enough. I've had meetings with leaders, and I've actually had one-on-one meetings where the person is not giving me their full attention. They're on their phone, they're texting, they're just a minute, I have to take care of this. And that's that time that that person scheduled with me, and it was supposed to be meaningful, and they weren't present. And I struggled with that. It made me feel less valued. And so when I have people that come in my office, I put down everything I'm doing. I push away from my computer and I kind of scoot over and give them my full attention, because that's what I expect. So, excuse me, I'm sorry. I think that's so important. It's just to make sure that you're present for your teams and for your people. And it's not easy because we all have 10 different things, and I don't close my door. The only time I do close my door is if it's a private meeting over Microsoft Teams and you can't, you don't want everybody hearing it. But as soon as it's over, I'm up opening the door again. So I'm not saying you can't close your door, but to me, that sends the wrong message. I want to be present for the team. I want them to know they can come anytime, ask me a question, and I'll give them my full attention. So again, just that positive culture, it just always goes back to us, to the leaders. And just align your behaviors with your organization's values and principles. So I'm going to share with you our my hospital's mission and vision. These are our pillars. So we just added a new one, so I don't have an updated slide, but we have people at the top. We strive to be the best place to work. And then we have the quality pillar to promote safe and timely, effective care. We have service to our patients. There's the people again in our community. Innovation. We still have a lean team. I know many organizations are kind of moving away from that. I got my lean training through Virginia Mason in Seattle, and I actually got to do it with a Japanese sensei. They did the Toyota production system, and the senseis came every month to listen to our report outs on our Kaizen events, and I got to do that. It was so cool. But we still support the thought of innovation. We have all of our team members go through lean training, and we encourage them to do projects and look for process improvement. And then access. We all have access issues, don't we? We're all striving to meet the needs of the community and the demand. And then stewardship, being financially responsible. We're putting more of that on our leaders to learn how to run the department, how to look at budgets. And then the pillar that we added was community. So we are starting to get more involved in the community and asking our team members to do the same. So I volunteer. October is always a busy month for me. I do the breast cancer. We have a local race, so I work at that. We do health fairs. We do lots of different activities. So we encourage our team members to get involved in the community too. So intentional leadership. I firmly believe that if you do everything with an intent, a positive intent, you're going to create a culture where people feel connected, empowered to live to be their best selves. Team building. There's so many team building exercises. There's some cool little cards. I don't know where you guys are from or where you live, but I love the Dollar Tree. That's my favorite store. You get everything really cheap. But I found this little deck of cards, and they're kind of like icebreaker cards. And you sort through them, and you pick one topic, and it says, like have everybody say what was their favorite childhood toy or something like that. So they're just something simple, but you can start out a staff meeting with that. They're kind of like icebreaker cards, but just starting out something small, and it gets your team talking and talking about things that aren't just work related, and that helps your teams connect. Again, all these things I'm just talking about are ideas and things to promote that positive culture. Always recognize and reward behaviors that you want to see continued. I know that at first it seems like we're rewarding people for doing their jobs, but yes, that's what we're doing. And as leaders, that's what you should expect for your direct reports. If you've got supervisors or others reporting up to you, my organization requires us leaders we have an internal thing called the Shannon Hub. It's kind of like a website or web page, and you can send shout outs to people and things like that. So we are actually required to send 20 Shannon Hubs a month. And then we're also part of something called LeaderCast. I don't know if you've ever heard of that, but they do videos, educational videos. And so we have to watch 5 videos a month as leaders. So at first, when we tried to get our supervisors on board with doing that, they felt forced. They were like, no, that's not authentic. You're making us do that. It's, we got a lot of pushback. But again, I had to talk to my team and say, okay, well, let's shift your mindset a little bit. How important is it? Do you like it when you get told thank you for doing something that maybe was outside of the norm, or oh yeah, I do, come to think of it. So that's all we're asking you to do, is not, they even like post people's birthdays and things like that. So I will send them a happy birthday, and you can send it private, so it's not published to everyone. But I'll do that, but I'll say happy birthday, I hope you have a great day. But then I'll always put something else, like I really enjoy working with you, or I appreciate that conversation I had with you not too long ago. So I put something personal in it. It's not just a happy birthday. So just getting your teams and setting those expectations and asking those people that report to you to do the same thing and get them to be on board. And then just squashing those conflicts and that negativity in the moment when you can. Those make a huge difference on your culture. So why do all these things matter? They sound like a lot of work on top of the work we already do, but it's so important because it boosts morale, it keeps people motivated. This is my team. I actually had them come to this lecture here that I'm doing today because I needed to practice. This is my only second time speaking ever. So I asked my team to come and listen to me and give me feedback. And I guess I should have known better because I'm their boss. So they just told me it was great. And so nobody gave me good, honest feedback. But it was during December, so I had them do a team building exercise. I bought a gingerbread house, and I gave them like direction. And so somebody had to take it out of the box. Somebody had to put all the parts and sort it. Then somebody was on design and construction. Somebody was on decorating, and somebody was on cleanup. And they chose their individual jobs, and they built the house together. But the 2 ladies on this far end with the gals going like this, they actually had a recent conflict because that was my diagnostic x-ray supervisor and the ultrasound supervisor. And we had an x-ray tech who got chosen to cross-train into OB ultrasound. And they did not agree on the timeline of when that employee could transfer. And HR doesn't really give us a lot of guidelines. I know some places I've worked have said you have to do it within 30 days. In Washington, it's a union state, so you're driven on when you can, you have to let them go. You can't hold them back. But Texas, I think we're free for all. There's not a lot of rules. But they didn't agree. And so they had conflict. So I was curious to see how they were going to do with this exercise. And I was so proud. They sat by each other. I don't know if they meant to, but they actually worked together. And by the end of the time, they were laughing and talking, and it was great to see. So just something small like that can actually help resolve conflict and build those teams. So I did everything that day with intention. So just that intentional leadership. Just alignment of goals, make sure everybody's on the same page, and all of that will break down those silos. What am I doing? So this one is a big thing for me. What is your leadership impact? What is your legacy? What are you going to leave behind? What are people going to say about you when you move on or retire or whatever it is? I don't know. Somebody said this to me recently. As leaders, we're often people's dinner conversation. Have you thought of that? I think I've talked about my boss over dinner before, right, with my husband. Oh, I had a bad day, my boss, like, can you believe this happened? So as a leader, think of that. You are going to be somebody's dinner conversation at one point or another. Are you going to be proud of what you did that day or what they're going to say? I know that it's a fine line because we don't want to get so focused on what people think about us, but what kind of leader do you want to be? This was an assignment from my AHRA Leaders of Choice class that I participated in over the last year with David Waldron. He asked us to create and build our own personal brand. So if you were in Trisha's talk just right before this, she talked about having your own personal mission and vision statement. And that's something I did as well. So it keeps you focused on your goals. It keeps you just in the right mindset. Anytime I need to refocus or reset myself, I go back to these goals. So I aligned my personal goals with my company's goals. So at Shannon, our mission and vision is to be trusted and to provide exceptional healthcare. So my vision is to be a trusted leader. I want to provide exceptional leadership. So I want my people to know that the answer I give them is the right answer, or at least a very good answer. I want to be trusted. So to do that, I don't often answer in the moment. Now, I know there's occasions where we need to, when you're putting out fires and problem solving, you've got to make a quick decision. I'm not saying don't do that. I can do that. But if it's something that's going to impact others or be a big change, I often say, that sounds great, but I need to think on it and let me get back to you. When I was first taught that, I thought, oh, that sounds kind of dumb, like that's a canned response. But actually, when I started doing that and practicing, it built trust. So that people knew that I was going to put a lot of thought into it and give them a very thoughtful answer. And now because of that, I feel like I'm a trusted leader. And then I want to help my teams improve their departments and their culture by leading by example. We had our teams create their own mission and vision statements. So this is one that my MRI department came up with. We have 7 MRIs in our fleet. They have had a tough culture. They had a leader that has been with the organization for over 30 years. He was sort of just coasting by. He's a great guy. He's fun-loving. He's great with patients, but I think he was just done with being a leader and all the demands that we're putting on our leaders these days. So his department was suffering a little bit. In the end, he decided to step down and let someone else come up. And so the department's going through a shift. So we picked that department to try setting their own mission and vision. And so this was one of the first exercises she did with her team. And they came up with this. So they have a team purpose, and it's posted in their area. So to deliver high quality imaging services using advanced technology to ensure each patient receives timely, safe, and compassionate care. So that gives them something to focus on. I was kind of proud. And then we did it at the breast center as well. So the breast center is something that I'm very passionate about because I'm a mammographer and a breast sonographer. And I've spent most of my career in mammography and managing mammography departments and centers. So it was really hard for me to kind of step back when I got promoted to assistant director. I promoted my lead tech to manager, and she's done a fabulous job, but that's her, the tallest one. That's Kayla, my breast center manager. And then that's me, and then that's our physician, Dr. Snuggs. We volunteered at a health fair. And so again, that's one of those things that I talked about is get involved in your community, get involved in things, and let your team see you out there and be present. Let them see you doing these things. But the breast center, their purpose statement is at the Shannon Breast Center, we strive to provide a supportive and collaborative environment where early detection, education, trust, and compassion come together to promote lifelong women's health and wellness. So she reads this at her staff meetings. She opens her staff meetings with our company's mission and vision, and we always have a value of the month, and we talk about that. This month it's respect, and then we'll talk about that. And then she reads her team's purpose statement. These are a great way, if you have your department come up with one, that if there is employee conflict, you can lead them back to, hey, but what is our purpose? What is our department's purpose? And it's something I think that you can use to help keep that positive culture going. So I'm at the end, which I don't think y'all will be too upset about since I'm the last talk of the day. But this is something that I came across and read, and I really like to say, just because we're all so busy, we are experiencing all that change. We want to lead our departments with that positive culture, but there's always going to be time to get the work done. So don't miss an opportunity to connect with someone. To change that culture, you've got to be present and practice positivity.